luxury cruise ship battling a deadly hantavirus outbreak is headed for Spain's Canary Islands. So far, 3 people have died, with a total of 8 believed to have contracted the virus. But with nearly 150 people still on board, what happens when the MV Hondias reaches port? Once the ship arrives, healthy non-Spanish passengers will be flown home. The 14 Spanish passengers will be quarantined in a military hospital in Madrid. How long that lasts will depend on possible exposure, as the virus can take up to 45 days to show symptoms. The World Health Organization confirmed tests show it is the Andes strain of hantavirus. Maria Van Kerkhoff is the body's director of epidemic and pandemic preparedness.
We only have confirmation, lab confirmation, from 3 of the 8 individuals, so there are ongoing lab investigations. Only 2 have had sequencing done. This is really enough for us at the moment to, understand that it's the Andes virus. I have to say that since the beginning, we've been assuming that it is the Andes virus, just given the path of the ship.
Unlike most hantaviruses, this strain can be spread between humans. However, unlike COVID, that's only through very close and persistent contact.
People develop respiratory symptoms, and they can have very severe respiratory symptoms requiring mechanical ventilation, requiring oxygen support. And so if they do have respiratory symptoms, they have these infectious particles, as you know, from other types of diseases, but some of those can infect others. But it's really in that close contact. It's not something that stays, present in the air.
The WHO says the 3 people evacuated from the ship will get treatment at specialist hospitals in Europe. It's working to follow up with travelers who left the boat earlier. In the US, health watchdogs are closely monitoring Americans who are on the ship, but say the risk to the public is currently extremely low. Passengers still on board the Hondias report that morale remains high. They are following safety measures like using masks, sanitizing hands, and limiting close contact while waiting to go home. The WHO says neither they nor the wider public should panic.
I should take a moment to say how important risk communication is here in informing the passengers on board and also the wider public. What kind of threat? Is this the next epidemic, the next pandemic? It's not. It's not. We have a situation. We're taking it seriously. It's a public health event that we are dealing with, but it's very different than an epidemic and a pandemic, like the world has recently experienced.